This is Selma Schimmel at ASCO 2011 as our discussion continues with key opinion leaders and physicians reporting on various areas of data being presented here across disease types. And we're going to continue our discussion about lung cancer with Dr. Paul Bunn, James Dudley Professor of Lung Cancer Research at the University of Colorado Cancer Center. He's also the Executive Director of the IASLC, that is the International Association for the Study of Lung Cancer. Hello, Dr. Bunn.
Good morning.
I'm very happy not only to sit with you here, but in anticipation of soon sitting with you in Amsterdam.
Yes, Amsterdam will be the 12th World Conference on Lung Cancer, which is the largest meeting solely devoted to lung cancer. It is sponsored by the IASLC, a multidisciplinary organization involving healthcare professionals and patients advocates interested in lung cancer from around the world.
This is a unique meeting. One, of course, it's global, and I know it goes from various locations. It could be in the United States one year, in Europe another year, in Asia yet another year. So it really attracts a diversified audience. Let's talk a bit about the travel awards that you've got available and the very large advocate focus because we're going to be producing a program with the advocates there. But talk about the travel awards.
Well, lung cancer is the leading cause of cancer death in the world, and it's the leading cause of cancer death in both men and women. Sometimes those facts are overlooked, but they're not overlooked by the patients and their families that get lung cancer. And the outcome is better than it has been in the past, so we have more survivors, and therefore, not surprisingly, we have more advocates, and the advocates are interested in what's going on, and of course they want to participate in what's going on. So this year, at this World Conference, the Society provided travel awards for small advocacy groups to be able to come to the meeting to begin with. And second of all, there's a program for advocacy groups where there's special sessions that are just for advocates.
I really appreciate that you have recognized the dynamic and influential role of patient advocates. Advocates can drive research. They reach the patients directly, hopefully inspiring them to consider clinical trials. But advocates are really the researcher's best friend in the sense that they are able to communicate the messages and raise the profile of a disease type directly to the people that need to understand and access cutting-edge therapies.
The Society is undertaking a strategic planning process on how to relate to advocacy organizations and how to provide information directly to patients as opposed to, information directed at healthcare professionals is something that the Society is only now beginning to grapple with.
One of the advocate programs we're very pleased about collaborating there with you is the Advocacy in Action show that we're doing, where we're going to gather many of the lung cancer advocates both from the US and from Europe and from Asia, really a global advocate audience, tackling the issues that impact the advocate community, thereby the patient community.
Right. As you know, the advocate community is not necessarily uniform or tied together either. And some advocacy organizations are interested in supporting research, some are interested in political action, some are interested in just local support for patients locally. So, but the impact of all of them, of course, will be better by having some common goals and some common purposes and acting together.
In lung cancer in particular, the speed of change necessitates the advocate community working side by side with the academic community to disseminate information. And I think it's incredibly progressive that the IASLC and WCLC has the awareness. It's a very astute position to bring the advocates in.
Right. I believe in that firmly.
What are we going to hear about at the WCLC meeting?
One of the things that we lagged behind in before was screening. And we didn't have a mammography, a colonoscopy. So soon to come out in the New England Journal are the results of the largest screening test ever done, where 50,000 high-risk smokers were randomized to get one of 3 annual spiral CT screens or not. And the results of that were made publicly available a few months ago, and the results will be presented in the New England Journal any week now. But what they showed was that there was a 20% reduction in lung cancer mortality by having these 3 annual spiral CT scans, and there was a 7% reduction in all-cause mortality from these 3 annual spiral CT scans. And so that and a statement about how that might be done and the unanswered questions will be done at the World Conference on Lung Cancer. There'll be some more things on smoking and prevention, and as well as many advances in treatment. Just like there's advances in drug therapy, there's major advances in radiation and in surgical techniques as well. Now we have video-assisted surgery, which are becoming standard, robotic surgery, and these will improve the outcome for lung cancer patients as well.
So will there be new research presented at WCLC that we're not hearing about yet at this meeting?
At the World Conference on Lung Cancer, the scientific community submitted 1,900 scientific abstracts on lung cancer. At this meeting, there's about 400 scientific abstracts that were submitted. The difference is, and it's not a criticism or anything else, but some societies are mostly medical oncologists. The ISLC we talked about before is multidisciplinary, so the surgeons are presenting abstracts, the epidemiologists, the radiologists with the prevention trials, the radiotherapists with new techniques, pulmonologists, pathologists.
And we're going to get a chance to speak with this multidisciplinary team.
You should.
So our viewers are going to be able to tune in to the WCLC conference videos, and they will have an interdisciplinary roadmap, and they're going to understand exactly from the time of diagnosis what goes on and the role of the pathologist and the molecular pathologist.
If you do your job right, they'll understand that whole spectrum. They will all be there.
Remember, you heard it here first. Thank you, Dr. Paul Bunn, James Dudley Professor of Lung Cancer Research at the University of Colorado Cancer Center, Executive Director of IASLC, that is the International Association for the Study of Lung Cancer. And thanks to Dr. Bunn, Vital Options in the Group Room is going to be going to the World Congress
On lung cancer.
on Lung Cancer, WCLC.